Centers for Disease Control and Prevention may be the least well understood health agency, but it's the backbone of public health in this country. And as Harvey said, has been systematically reduced in budget authority. The good news is that the Affordable Care Act had, for the first time, a stream of money dedicated to prevention, the so-called preventive fund. Unfortunately, it has had to be used in large part to backfill what Congress has done to the CDC. And the CDC is our surveillance system, our health system, not only here in the country, but globally. And I know Tom Frieden was here talking a little bit about the Global Health Security Initiative. If we want to keep Americans safe and secure, if we want better public health in this country, we have to pay attention to what's happening around the globe, and CDC is very involved in that. That's an education issue that has to go on day and night, where people understand how critical it is to monitor outbreaks, how important it is to drive public health, and how important it is to focus on data points that tell us what's going on and what's harmful to Americans. NIH, on the other hand, I think is not only the gold standard in this country, but in the world for medical research. And we have research collaborations going on all across the globe. There was a big influx of new NIH money in the Recovery Act, but that produce a bell curve, which in some ways may have been more difficult than a gradual increase over that period of time. I am so tired of the politicians who say the following: I love the NIH. I love research. I am all for this. I'm for accelerating cures. I am for, finding the next great breakthrough. And yet I'm going to vote for sequestration. I'm going to slash the federal budget. I'm going to diminish federal resources. NIH is 40% of the discretionary budget of the Department of Health and Human Services, 40%. There is no way you can decrease the budget of Health and Human Services and not hurt NIH. It just can't be done. The math doesn't work. We have to stand up, I think, as taxpayers and say, nothing could be worse in this economy looking into the future than cutting research and innovation in this day and age. And you can't do it without new money. We need new money at the table. So we need to both put CDC back where it belonged, but also fund research and innovation, which countries all around us, our global competitors, understand, which is why they're doubling down on research dollars right now as we are leveling out of research dollars. It is dangerous for our country. It's bad for young scientists who are moving overseas so that they can do the kind of research and grants that they want. And it's just, frankly, a stupid economic proposition. Makes no sense.